please, if you have some problems understanding, we will ask Afrodita to help us in translation of the presentations. Thank you all for joining us this afternoon. This is one informative session that is organized by a community of practitioners on accountability and social action in health, Europe. The network is known as COPASAH Europe. So today's session aims to bring closer the work of COPASAH Europe and our activities as network through a series of examples that will be presented by our network members. So thank you again. What I would like to emphasize is that the enlargement of the family of COPASAH Europe and also the regional cooperation and support, also the exchange of knowledge and resources are one of the key values of our network and shared by our members. During this event we will get closer to the scope of work of COPASAH Global and COPASAH Europe. We will have the donor perception of COPASAH and the importance of networking. We will hear about the benefits of participation in COPASAH network and the benefits of our organizations and their beneficiaries from participation in COPASAH Europe. This event was aimed to inform you about our activities and our work, but also to encourage you to join our activities and also to support our work as a network. So my name is Darko Antic. I am coordinator for budget monitoring and advocacy in Association ESEF from North Macedonia, and I'm also the president of COPASAH Europe steering committee. On this informative session, we have with us Afrodita Proni, director at Human Rights and Democracy Center from Albania. Then we have Borian Pavlovski. He is connected through Zoom. Just a second. Borian Pavlovski, he is public health coordinator in association at ESF from North Macedonia and also member of the COPASAH Global Steering Committee. Then we have Yves Breker, associate director of civic engagement from PI US and also a great supporter of COPASAH development as a network. Yves is here with us on the screen. Aminu Garba, Global Co-Governor of COPASAH Global from African Health Budget Network from Nigeria. He's also joining us through Zoom. Then we have Ariel Arroyo, COPASAH Global Steering Committee member and also South America Hub lead. You will hear his presentation and he is joining us through the Zoom link. Then we have with us Eugen Gita. He is COPASAH Europe Steering Committee member and representative from Roma Just from Romania. Then we have Maria Radovic. She is also member of COPASAH Europe and she represents Juventus from Montenegro. And Kristina Zdravelska, COPASAH Europe member and representative from Let's Station from North Macedonia. Please, all the presentations will be in the order that I have introduced the speakers and presenters. Thank you very much again. If you have some questions or comments, please feel free to write them during the presentations, and you can ask the participants or the presenters at the end of the presentation. Please, Afrodita, you can open the event as a host.
Going to come here? Or?
You can come here.
Ska I di fjalë shqip sepse prezantimin do ta bëj në anglisht, është shumë i shkurtër, gjithë do marr 5 minuta. Ju falenderoj shumë që gjetët kohën dhe mundësinë për të ardhur dhe për të bashkangjitur këtij aktiviteti që është i rëndësishëm. Presentation. Në sesionin e paraditës, në fakt, patëm një prezantim më të gjatë të gjithë organizatave që janë pjesëmarrëse në këtë konferencë, kështu që pam që problematikat janë pothuajse të njëjta për gjithë organizatat, pasi si organizata punojmë në rajon, punojmë shumë me dhunën familje, me diskriminimin, me aksesin shërbime, me ndërtimin e kapaciteteve e tjerë. Kështu që ky prezantimi i dytë, po i themi për sot, do jetë shumë i shkurtër, do na marrë 5 minuta dhe pak a shumë do jetë i fokusuar jo vetëm në prezantimin e organizatës, por edhe disa përfitimeve që ne si organizatë i shohim si të rëndësishme duke qenë pjesë e këtij networku, që është kryesisht i fokusuar në mbrojtjen e drejtave dhe promovimin e drejtave të njeriut, si dhe shëndetin e grupeve vulnerabël në gjithë këto 5 shtete anëtare dhe punën që bën organizata jonë në këtë drejtim, në sigurimin e shërbimeve për grupet vulnerabël, shërbimeve mbështetëse. Si organizat, ne punojmë shumë me dhunën në familje, prej vitit 2006, kur organizata, ligji, domethënë për dhunën u miratua nga parlamenti dhe që atë kohë, gjithë të vite, ne punojmë në drejtim të ofrimit shërbimeve falas për grupet vulnerabël, ndërtimin e kapaciteteve të ofruesve shërbimeve, monitorimit të punës gjithë ofruesve shërbimeve në drejtim të mbështetjes me shërbime mbështetëse për viktimat dhe të mbijetuarat e dhunës së familje, ku një nga, si thua, shërbimet më të rëndësishme dhe komponentin ndër më të rëndësishëm i punës sonë është ofrimi i ndihmës ligjore falas dhe përfaqësimi falas në gjykatë. Do të thënë që prej vitit 2006, kur Shqipëria u pajis me një ligj për dhunën në familje, kemi mbështetur në gjykatë me shërbime ligjore qindra raste grazh, vajzash, jo vetëm nga Tirana, po edhe nga qytetet e tjera të Shqipërisë ku organizata operon. Të përmendim Tropojën, Kuksin, Krujën, Vorën, Kamzën dhe Tiranën. Po, vazhdojnë anglisht for here. I just made a presentation for the HRDC, so I will continue now in English. Can you please?
You can use the remote. This one?
Oh, remote. Okay. 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 No. Okay. As I said, we are established in 2002, and our mission is to improve the human rights situation in Albania with a special focus to women's rights. We work in different levels. I forgot to mention that HRDC is accredited by Albanian Parliament since 2019 as a strong lobbyist organization and is entitled to attend Parliamentary Commission meetings, also roundtable organized by them. We work in the direction of harmonization of domestic legislation, domestic violence law, Sub-Legal Act, anti-discrimination law. We provide services, as I mentioned, to the victims and survivors of domestic violence, monitor on the ground implementation of legislation, mainly focused on justice system. We, in these municipalities that I mentioned before, we support the coordination referral mechanisms in 5 municipalities of Albania, build capacity of state service providers like police, health, teachers, staff of municipalities on the implementation of legislation. As we talked in the morning session, we work a lot with drafting of stakeholder and shadow reports regarding various conventions signed by Albania, such as CEDAW, GREVIO, UPR, and Convention on Economical and Social Rights. we also work a lot on the lobby and advocacy, not only in national but also international level. If we summarize what we have done in the field of health, because this is not the first engagement of HRDC in the field of health. We, since 2002, the year that we were created, we have undertaken awareness activities focused on awareness of community on health rights under the slogan "Health as a Fundamental Human Right." We have undertaken awareness campaigns focused on issues of health, such as prevention of HIV, provision of healthcare services in penitentiary institutions, like in women's section. We have provided suggestions to policy makers to include screening in primary health care, and we have submitted these suggestions to Council of Ministers and Institute of Securities of Healthcare. We have advocated for appropriate legislation and policies, including reproductive health and rights, and raise awareness among populations and groups at risk. And we have advocated for and inclusion of health issues in country reports and preparation of stakeholder and shadow reports, and have provided recommendations to improve the situation. These are some, let's say, publishings of HRDC regarding the field of monitoring of court decision. It means justice system. We have booklets on information, on legal information of women, but also including health information. And the last picture is a booklet that we have produced years before and disseminated to communities, especially outskirt communities, regarding the health as a fundamental right. We are part of several networks based in Albania and region. We are part of WIDE, member of Victim Support Europe, which is a network run by Victim Support Europe in Brussels. We are member of International Roma Women Network. We are member of Monitoring Network on Gender-Based Violence in Albania, which is, I think, comprised of 30, let's say, well-known or outstanding organizations which work with the issue of domestic violence in Albania. And members are from all over Albania, active members. And since 2023, we became member of COPASAH, and we are looking forward to work with them and to do good, good acts. As Darko explained more, I'm not gonna stop to the Europe, COPASAH Europe, because he already explained. But to, let's say, mention the benefits of HRDC to become member of this network, we expect, and we have already started to see, to get to know deeper the organizations which work in the area of women's rights in a regional level, to join efforts with these organizations aiming to improve situation of respect of human rights in our respective countries, especially in the area of health and social rights, lending best practices from the region and implementation of these practices in our countries, and bring our voice and local expertise and views to the network, to strengthen women voices, including women from disadvantaged, marginalized groups at a regional level, increase our organization profile in the NGO community, establish common positions on policy issues related to respect of the health rights, share resources, capacity and methods among members of network, promote accountability of state in case they fail to provide services for vulnerable groups, and meet standards to achieve social justice for all. as well as to lobby and advocate jointly with other members of network for better legislation and better implementation of this legislation. We, through data collection and analysis, to identify gaps, and these data will help us to conduct joint advocacy and lobby in regional level. Also to share the best practices and to thank you for your attention for this very short presentation about the expectations that as organization we, let's say, look to see forward as being member of this network. Thank you for your attention.
Borjan, you can go next.
Now at the moment, I was able to attend the line at Tirana, but supporting obligations came through. As time forward, Esmindar as already mentioned, I'm Pavlovsky from the association from North Albania. I'm coordinator of the program for Women's Health, and I'm also member of the steering committee of the Global COPASAH. So I will briefly present to you what is the Global COPASAH network and what is the regional European subnetwork of the COPASAH. I will start my presentation right now. Can you see it?
Yes.
Yeah, okay. Perfect. Just a moment. The COPASAH network, the community of practitioners on accountability and social action, that is what COPASAH means, is a global community in the world, mainly from the global south, where practitioners who share an interest and passion for the community-based work and accountability. These are the two main aspects that all the members of COPASAH are sharing. So working with the communities, the vulnerable, the marginal, the communities, and demanding accountability in health. So the members of the COPASAH who share these values and interests are regularly engaging in experiences and lessons. Global COPASAH, I will share the website later on so you can find more. And in 2019, before the pandemic, we also had a global symposium of COPASAH in New Delhi, India, where practitioners from all over the world together and directly shared knowledge and experience. We are producing many, as I said, conceptual, methodological, and practical outputs for strengthening the work on social accountability, on social action and accountability for demanding of the methodological rights for vulnerable groups with the population, marginalized communities. We are networking, we are bringing partnerships together. This is a platform where practitioners from around the world can find about each other's work and can develop partnerships and build capacity among each other. It was established in 2011 on a workshop held in Johannesburg, South Africa, supported by the Open Society Foundation at the time. main mission that COPASAH network is sharing that all the communities, especially the vulnerable ones, are actively engaged in promoting accountability and transforming health systems towards the realization of social justice. So our vision is to empower and strengthen the communities to demand accountability and advocate for themselves instead of someone else speaking on their behalf. And the mission of COPASAH is to nurture, strengthen, and promote the knowledge, skills, and capacities of community-oriented organizations and health activists working in the field of accountability and social action for promoting active engagement of people and citizens to make health systems more responsive, equitable, and people-centered. So COPASAH network not only that is open to trusted organizations, for regional or national organizations, but also for individuals that share passion and desire or experience to work in the field of social accountability or achievement of the health rights of the vulnerable groups of the population. So, exactly based on what I have said, the values of COPASAH is to enable the communities which are facing inequities to demand their rights and to participate in specific actions in order to make change in the health services, in order to improve equitable distribution of the resources and for the vulnerable population to have access to the quality and timely health services in a proper way. To give voice to people's perspectives, we all engage the communities in the monitoring work and in demanding identifying their needs. So through the network, we give the people's voices and perspectives through our reports and through our demands, through our written concepts. So the network empowering process where actors involved in the health system are encouraged to this power imbalance affect people's health. The power imbalance in the healthcare systems in many countries, in most of our countries, bring justice in receiving health services for the vulnerable, marginalized from the population. And also we are joining in the network to develop advocacy actions together and change policies or the way the services are delivered. So as I mentioned before, COPASAH is a network which nurtures community practitioners, which is done to the systemic exchange of knowledge and practice through different methods and approaches like newsletters, webinars, symposiums, workshops, and so on. We collect and produce materials which are publicly available for interested parties, organizations, and individuals with experience are producing materials in order for others to become more familiar with the work that we are doing. We are informing and influencing other people. We are building alliances among members. We are building knowledge on the members of the network, and we do collaborative action as it is exactly the workshop that COPASAH is having in Tirana at the moment in order to collaborative action of the members. A little more about COPASAH Europe. We share the same values, the same principles as the global COPASAH. It was established in 2021 and represent the regional subnetwork or hub of the global COPASAH, and we share the same values of the COPASAH global. We have members from North Macedonia, Albania, Serbia, Montenegro, Romania, Bulgaria, and Greece. And we also provide facilities and practitioners from Europe to practitioners from around the world. We also do webinars, newsletters, workshops, and we are jointly planning the work of COPASAH Europe and doing advocacy on national, international, and local level. These are some of our webinars, newsletters, joint workshops. And we have two main priorities: women's health and help the vulnerable and marginalized groups of the population, but also we are open to any other types of work. You can find more on COPASAHEurope.org and COPASAH.net. Thank you very much for your attention and additional questions in the discussion. Thank you.
Thank you, Borjan. I will invite Eve next to go with the presentation.
Hi, good afternoon, everyone. My name is Eve Brecker. I'm the Assistant Director of Civic Engagement at PAI, which provides financial and technical support to COPASAH Global and its regional thematic hubs, including COPASAH Europe. So thank you for this opportunity to be part of your meeting today. I'm speaking here today as a donor to COPASAH. It's a privilege and an honor to support them. As a donor, we know that despite a lot of progress in advancing health outcomes over the last several decades, there remain unacceptable inequities in health access and rates today, both between and within countries, which reflects varying levels of economic development, healthcare systems, and social determinants of health. So, for example, in Romania, despite improvements in recent years, there are still disparities in access to healthcare services, with rural populations and marginalized groups experiencing limited access to quality care, particularly around non-communicable diseases. Ukraine also grapples with health inequities due to economic challenges and the ongoing conflict. The country faces high rates of infectious diseases, including tuberculosis and HIV, and inadequate healthcare infrastructures in some areas exacerbate these disparities. So we all, myself and all in this room today, recognize that social accountability is a powerful tool to address these inequities by ensuring rights holders can demand quality access and equity from health services. Evidence shows that community members participating in social accountability efforts gain valuable knowledge about their rights and entitlements. And evidence also indicates that social accountability efforts contribute to a few positive outcomes, including improved trust and understanding between patients and service providers, strengthened infrastructure and supply chains, and influences positive policy and budget change to increase accessibility of health services. So in light of this, funding social accountability networks like COPASAH is really vital to long-lasting improvements in health outcomes and community strengthening. And I want to share with you a few thoughts around the value added of COPASAH from the donor perspective, and why donors, speaking as PAI, believe that funding networks like this is important. So, as my colleagues have mentioned just prior to me, COPASAH serves as a platform for practitioners, researchers, activists from diverse backgrounds to exchange knowledge and best practices in social accountability through global webinars and regional trainings. By funding COPASAH, then donors are invested in the development of skilled and strengthened practitioners who can then drive positive change in their communities. Another crucial role of COPASAH is to amplify the voices of communities and marginalized populations who often face barriers in accessing quality health care. Through its practitioner network, COPASAH supports advocacy efforts to address systemic issues and generate policy changes. And so by funding COPASAH, donors contribute to strengthening these communities and increasing their ability to hold decision makers accountable for health decisions. One thing that's really special about COPASAH to the members and to donors is that it's the only entity of its kind that's self-organized and operated by Global South practitioners and places a strong emphasis on South-South collaboration, recognizing the value of shared experiences among countries that are facing similar health challenges. So by funding COPASAH, donors Donors support the network's efforts to facilitate collaborations between practitioners from different regions, promoting mutual learning and adaptation of successful strategies in diverse contexts. The last thing I'll add is that perhaps the most critical aspect of COPASAH's work is its contribution to strengthening accountability mechanisms themselves for help. By funding the network, donors support initiatives that promote community monitoring, participatory budgeting, citizen reports, and more. These mechanisms ensure that health systems are transparent, responsive, and accountable to the needs and rights of communities. So, to tie this all together, funding social accountability networks like COPASAH is not just an investment in one entity, but it's an investment in the well-being of communities and in the advancement of social justice. And by supporting COPASAH, we support the network to foster knowledge exchange, amplify voices, build capacities, promote collaboration, and strengthen accountability mechanisms working towards a future where every individual has access to equitable and quality healthcare. Thank you.
Thank you, Eve. I will invite Aminu next.
Darko had dropped off, unfortunately. I texted him.
Yes, then Ariel, you can go the next. Ariel, can you hear me?
Yes, hello.
Okay. We can hear you.
Great, thank you. Good afternoon with everybody. Thank you to COPASAH Europe for this invitation. I will try to stick to my 5 minutes. Need to talk about how COPASAH promotes citizen engagement. Try to do this in 5 minutes. So, first of all, I'm Maria Sancho. I'm the coordinator of COPASAH South America Hub, medical doctor by training. I have been involved in issues of citizen participation, governance, promotion of accountability along many years. So we could first maybe talk about where does accountability take place, and we are talking about accountability to whom. Usually we should talk about three levels. Accountability takes place within the health system. So there are channels, administrative channels for management within the health system that come from accountability from subnational areas to national areas about internal control mechanisms of budgeting, expenditure, coverage, health goals, etc. There are also some government organizations that make external control of the performance of the system. And also there's accountability from local levels, national levels in the same issues. There are audit agencies, and sometimes these initiatives driven by the state invite civil society representatives to be more like witnesses of the work that the state is doing in terms of improving performance. A second level, or a second feature is the accountability in invited spaces. That means the government invites civil society representatives or citizen representatives for spaces where they provide information on the performance they are doing. Sometimes these spaces are not permanent. It could be a participatory appraisal, a performance reporting, or they could be regular. They could be periodic invited spaces like national, subnational health councils, district health committees, balance scorecards, exercises, budget overviews, etc. But usually the rules of the game of invited spaces are managed by those who invite. And sometimes accountability is misunderstood as just provision of information from one side. So there's no dialogue, and there's a big gap of power in the relation between those who call and those who receive the information and have their own thoughts that sometimes are not to be heard. A third feature would be accountability driven by the people. In concrete spaces, in spaces that need to be created because informed citizens are demanding improvements on the health performance, on the health responsiveness, on things that are important for the communities, on things that probably are not functioning as they would expect. And this is social accountability. We have experiences of civil society budget monitoring, like the one that Julian explained when he is available. Citizen watch groups, citizen monitoring of health services, financing and provision of services, citizen surveillance of the quality of healthcare, or user satisfaction, of fulfillment of users' entitlements that address non-discrimination, that gives light or sheds light on the table payments that unfortunately sometimes occur at the health facilities, that claim on the limited health staff or equipment or limited availability of medicines or access in general to health services, etc. So we are focusing the accountability in which the citizen engage or that COPASAH tries to promote for citizens to engage in the third one, an informed, conscious exercise of social action in which citizens take the initiative on holding state and government accountable for the performance of health systems. Now this is not easy. There are challenges within national health systems for this. The first one, at least in Latin America, are the cultural stark inequality gaps. Peru, Mexico, Ecuador, Chile, Bolivia, Colombia are considered middle-high income countries. This means for the economics that if you take all the economic product of Peru and you divide it into the number of people of Peru, each Peruvian has a middle-high income. Of course, this doesn't happen because of inequalities. Statistics is the only science in which you have your head in an oven and your feet in an ice cube. Probably your temperature is going to be average, and nobody will notice you're in a very big problem. That's what happens. Inequalities are really great in all our region. And sometimes these inequalities also reflect unequal power relations, in which those who are worse off don't have spaces, don't have opportunities, don't have information, and don't feel able to claim on their rights. There are also issues of underlying discrimination with indigenous people in our countries. There is a lack of accountability culture. And sometimes, as I mentioned, the big question is accountability to whom? Is accountability to the World Bank because of the World Bank money? Is accountability to the donors? Is accountability to the authorities? It never happens to be accountability to the people. It's very little that this happens. And also we have to mention and praise by Open Society and other agencies to focus on accountability and social accountability. Because with the Millennium Development Goals, there was like a transition from some donors to focus on performance metrics, which are important. But there are social processes that not necessarily you can capture in 1 year projects with specific quantitative results. No? So accountability, governance are processes that approaches that need to be better studied with new methodologies and new resources. So toward the question, and this is the center, how COPASAH has contributed towards greater citizen engagement. In 2011, when COPASAH was created, accountability was generally understood as technical actions led by international cooperation agencies or academia. Sometimes tools implementation, like balanced scorecards, became the end of the process, became the most important thing. But if you just focus on the tool, which could be better and could be a very good beginning, and don't give capacities, information, and create a culture of accountability as a principle, this could be just a session of information, a survey with no results. COPASAH proved that citizens affected by weak, non-accessible or quality health services could lead empowerment processes and enable themselves to claim health services improvement and rights realization. COPASAH allies, for example, follow diverse strategies. Some of them we mentioned before. Budget monitoring, citizen surveillance, health facilities, indigenous community leaders going to health facilities to oversee the experiences and what happens there. Could be diverse strategies, could be diverse methods or tools. However, our principles are very similar. Focus on information, capacity building and the creation and enabling environment for citizenship and individual empowerment. This is why we understand accountability processes as social action health. And how do we do this? And I think this is especially in our first steps, COPASAH has supported different social accountability initiatives and citizen engagement, public policies, strategies and actions. COPASAH, as we mentioned, offers diverse formative and knowledge-oriented tools and papers like newsletters. Most of them drawing lessons from the experience.
Ariel, can we shorten the presentation? Because
I will. In 1 minute.
Okay, thank you.
COPASAH study cases, position papers, and websites. We have webinars, blogs, WhatsApp groups to share lessons learned and promote collaboration. Finally, we have local, national, and global advocacy to promote access to health services. For example, in COVID-19 pandemic, we analyzed responsiveness of the health facilities from the eyes of the people, and we raised this in global fora. We need accountability to be understood in its main components, which are capacity building, information on data gathering, the dialogue and negotiation spaces, agreements of improvement, and redress. Without redress, accountability has a lot of problems to get legitimacy. Thank you very much. Sorry for the additional time.
Thank you. Thank you, Ariel. Aminu is here. I will invite him to give his presentation. But please, for the next speakers, keep your mind on the time. Each of us should present 5 minutes in order to have enough time for discussion or for any questions from the public. Aminu, you can go. Aminu, can you hear me?
Okay, thank you very much. Hope you can hear me well.
We can hear you. You go on.
Okay. Thank you, Darko, and all the COPASAH Europe regional team that organized this webinar. and also the opportunity for us to share in 3 to 5 minutes what are the benefits to engage with the global COPASAH, and also to thank Ariel, my friend, also from the Peru, the COPASAH South America region, and the PAI team that joined from Washington DC, Christina and Eve, and also Amy from Nigeria, from the Global Secretariat. So let me quickly inform the audience that the Global Secretariat of COPASAH is hosted in Abuja, Nigeria, within the Africa Health Project Network, and we are so privileged to be supporting this wonderful team of COPASAH, being operated from 6 global regional levels and also 23 thematic hubs. So I think, to me, one of the connections I would like to make in the benefit of engaging with the global COPASAH is the fact that we are even talking today in a regional conversation. So we from the Global Secretariat and Ariel from the South America Regional Hub, the fact that we are engaging and sharing our contribution to COPASAH Europe, this automatically helps you. There's a benefit in engaging with the global COPASAH. Because if there is no this mechanism of the global network, then myself and Ariel will not be here also providing our input. So the benefit summary is the conversation and the networking across all the 6 regions, including the thematic hubs, to ensure that the accountability conversation continues, engaging, we are learning from each other, we are coaching and mentoring, and also ensuring that practitioners are continuously being trained and also engaged to ensure local accountability issues are addressed. Issue of the vulnerable group, the marginalized population, the indigenous people who have not been given access to care, issue of equity in health, issue of access to essential medicine and drugs and consumables across different regions, and also ensuring that universal health coverage has touched everybody in the manner of social accountability, and also ensuring that the government and the international development are doing what is right to engage. So these are some of the benefits, and also another area I've clearly seen is the issue of the COPASAH over the years has transited in supporting the regional hubs to also be stronger and also provide leadership, which is also one of the benefits of the global COPASAH. Right now in our foundation, we are opportune to provide a sub-grant to 6 regional hubs plus 1 thematic hub in India. This allows the regional hubs to get flexible funding to engage in activities, organize seminar and webinar and training, and also develop tools and mechanisms to promote accountability and transparency at the local level and also at the grassroots. This thing is unique that we as the Global South Network were able to provide sub-grants ourselves in the 6 regions plus 1 private sector network in Delhi to ensure that the accountability conversation keeps going. And we are all aware, as Ariel mentioned, that not every international partner are interested in social accountability, and also the dwindling resources, the scarce resources available in accountability all over the world, we all know is very small. So we are happy that the global COPASAH continue to engage and strengthen the regional platform. And we are also right now repositioning our website to be able to provide all the regions sub-account and sub-domain, so that if we connect ourselves in one website, we'll be able to learn from each other quickly. This does not stop the regional hubs to have their own independent website, but by the time we reposition our website through our strategic development that we are doing now, we can also create links to everybody, and through that we are promoting partnership, we are promoting networking, we are learning from each other, and if there is any tool that we need to adapt at the regional level that another partner has done for another region. We can easily go to Webster and download without having too much headache. These are some of the delegates of engaging with the global COPASAH, and we look forward to learn from the COPASAH Europe and all the hubs as we implement our work in collaboration with the PAI, our global North friends and partners, and also we hope that this conversation and this experience will give us opportunity to engage more development partners to invest in social accountability. Thank you very much, therefore, for the opportunity, and I look forward to engage more in this global work. Thank you, and God bless.
Thank you, Aminu. Thank you very much. I will invite next Eugen.
Stay here. Put my presentation or not? You can.
Just to share the screen.
I can do from here, right?
Yeah.
I can send. I can send. Hello everyone. So I'm Eugen Gita. I come from Romania. I'm president of Roma Lawyer Association. So we start the collaboration with COPASAH starting in 2018 when we've been in Macedonia for one training about social accountability, and then we came back in Romania and started to do that action with municipalities, and starting then to have some information what they do, what is the local public policies, and we found out in one town about 75 families was prepared to be forced evicted from social houses, and then we started the fight to prevent that and to stop the the evictions. So that was possible because we have the tools and learning from the training how to keep the municipality accountable when it comes with the relation with the Roma community. So we have some small presentation what we do defending the human rights. What tools we have also with the legal caravan. We go with our lawyers and some human rights monitor to the community, and then we find the problems and we refer that to the municipality or the regional institutions. So our main objectives it's here. We give conciliation for vulnerable people. There is some containers where we found Roma families. So for our strategy in 2023, for this year, it's litigation, consultancy, and training. So we found how from our colleagues in other countries like Serbia, Montenegro, Macedonia, how to deal with that in Romania, and was a privilege for us, and also put us like Roma defenders right, put us in the map of the European level. So I had the chance to participate to the global COPASAH in India in 2019, and after that with our colleagues we started to see how it's to make that COPASAH Europe. So we started in July. I put here some maps like we are there like countries, and what is the important things to benefit from the COPASAH Europe? It's capacity building through developing strategy for our organizations, because until then we've been small organization, and we're learning how to have a strategy, how to have a budget, and how to keep the municipality accountable when it's come about the vulnerable communities. Thank you, and I have to be in the time.
Good afternoon. I'm Marija Radović. I'm from NGO Juventus from Montenegro, Podgorica, and I'm a member of steering committee of COPASAH Europe. I will be short today. I just want to present shortly our work and our benefits for our membership within the network. And so NGO Juventus is a non-governmental organization founded 1996 in Podgorica, and we are continuously implementing projects aiming to provide support services for vulnerable communities. And on a daily basis, we provide services to specific communities in risk of social exclusion. It's young people, LGBTIQ people, people who use or inject drugs, people who provide sex services, prisoners, former prisoners, and we provided some services during the last 2 years to asylum seekers and people under international protection. And within these communities we have Roma people as well, and we provide services to them. We are an active member of COPASAH Europe, and so far we have seen many good sides of our membership. We are gaining knowledge from different members, organizations and countries, so we could reflect it in our own system, and we can improve our practice. On the other hand, we share our knowledge about different practices, experiences, legislative solutions to other network members, organizations and institutions. And we have opportunity to gain some new information, experiences, ideas that have positive impact on our beneficiaries through improvement of our approaches and direct support services. We participated in different webinars and trainings with topics that are very important for Juventus and that are important for our daily work, and new information can be used in our future work and our future practice. And by connecting with other organizations, both in the country and in the region that share the same vision, we improve cooperation, we support each other in advocating for the changes in legislation and introducing new services and so on. Also, we motivate other organizations from Montenegro to become the members of the network and to spread the vision and activities that improve the protection of the beneficiaries' rights. With the support of the network and its members, we create new ways of involving citizens and beneficiaries in decision making. I think that's the most important area, because the aim of Juventus is to have beneficiaries that are have an active role in decision making and to be involved directly in our services. And we are creating an important database of the challenges faced by vulnerable communities in different countries, and what are good, what are not so good solutions, and all of this is an important input for our further activities as an NGO and direct support services as an organization. So I can conclude with that our beneficiaries can only benefit from our membership within this network. And for the end, I want to thank Darko and for all the organization of this event. Thank you, Aterbita, for hosting us here, and thank you all for coming. Thank you.
Ne, čestujem. Okay. Good day from me. Ditemir. I tried. Sorry for my Albanian, but it's first time and I had to say that I love the town. It's beautiful, very beautiful. Darko let me the last, but you know that I'm not the least important. So, I'm coming from Organization for Legal Education and Transparency, LED Station, from Prilep. It's a town in the west in North Macedonia. Shortly, who are we? Our organization was founded in 2018. We are a relatively young organization. Everybody asks us why the name LED Station. In Macedonian it's Stanica 5. And we say the term station is a place where everybody can turn and anybody can access. We are open to everybody. And as I say, the 5, it's PAT or LET, is an acronym and it stands for Legal Education and Transparency. We are a grassroots organization that we are focused on legal empowerment and access to justice for marginalized community, especially the Roma and people from rural areas. We try and we use in our everyday work the community-based approach. We are focusing on health and social rights as well as housing, environmental, citizen participation in democratic processes at the local level, transparency and accountability of institutions. As such, we provide legal and paralegal assistance and legal education. And I have to say that our motto is, if the law is not available to everyone, then justice is not available to everyone. And if justice is not available to all, it's not right, it's just a privilege. I hope you understand it. We are here today because of COPASAH Europe as a member from the very establishment of this network community. We are working on community monitoring for accountability in health, join in order to exchange our experience and to learn to practice. Also, we are sharing skills between us, resources and methods for building capacities among us, the member organization, and so we can conduct joint advocacy. And I must say that the network is a great benefit with which we can jointly achieve progress in the field of human rights, which is why we are all here today. We had, as we know, that climate justice or climate change is something that is very on agenda the last couple of years. So we are trying to raise awareness and inform the communities about the dangers of climate changes, and that's our team. We have created one creative action project, Well Dams, when we try to come to the communities and raise them so they can understand the danger of the climate changes. You can see we are dressed as constructors, although we are not constructors. So also, as my colleague Eugen says, they are having legal caravan. We are having mobile offices. It's something like, yes, we have 3 mobile offices, when one lawyer and one paralegal visit the rural areas once a week. And you can see this is the girl from the village of Mariovo. It's a very rural place, and it's like now city of the ghost, unfortunately. Also, we are providing legal aid, like legal advices, referrals, filling out documentation, legal assistance in exercising rights of the people. And also we have telephone and online service called emergency paralegal aid, which is active 24/7, and it was very it's not popular, but it was very used in the time of the COVID. Also, we are working on the health rights. We have health promoters in the community. Also, we have 22 activists from the community who provide help and support in exercising health and care rights. And also, we have the 24/7 telephone line called Health Promoter. So this is our contacts. If you have any questions, I'm here. Thank you for your
because we are done with the presentations. This is the official COPASAH Europe network website, copasaheurope.org. All the resources and all the events, all materials or trainings are available on the website. You can access to them and use them as an example or as a guidelines in your work. Also, the website provides and background platform for experience sharing and resource sharing among COPASAH Europe active members. So that's only a part when where only the members can access. To access the member, it's the network is free of charge. Everyone can be part of the network, not only a civil society organization, but also, as my colleagues mentioned, practitioners and those who would like to benefit from and to learn from someone else's experience, and also to follow and support the activities. You can join the COPASAH Europe through a simple registration where you will add just your details, like name of organization or name of institution that you are representing, brief overview or information about why you would like to be part of the COPASAH and how your organization can contribute to development of capacities of other COPASAH Europe members, and what are the benefits that you expect from the participation. I would like to thank you all for joining this event. I don't want to have only presentations from ourselves and to make you hear what is COPASAH and also what our members do. That's beneficial as well, but I would like to hear something from you as well. Please feel free if you have some questions for our presenters. If you don't have, I would like also to invite you for a brief introduction. Like what is the organization that you are representing or institution, and what is in brief what is your field of expertise, or what do you work? Please feel first we can go with the questions if you have some questions for the presenters, or some comments, not necessarily questions. Yeah. Afrodita, if someone is not comfortable with English, you can just translate.
Yeah, sure.
Okay. If there is no questions or comments, we can start with the.
Okay.
I would like to learn about US now. Thank you.
Okay. I start. My name is Hidayat Benoush, and I represent the organization Different NGOs. First of all, thank you for the invitation to be together and to be part of this network. Our organization is established since 2004, and our mission is to work for protecting victims of crimes, especially victims of trafficking. We have a shelter that we offer accommodation for victims, and we offer a full package of reintegration services for victims. As a profession, I am a lawyer, and I thank you for your presentation. I find myself as well as part of this network, because if we see the title, the COPASAH is focused on health, but I see that there are a lot of organizations that includes social services and protection of vulnerable groups. And, I thank you for the presentation and for this activity.
Thank you. That was my point. Because during the presentations, COPASAH Global, the main focus is health. But for COPASAH Europe, we encourage organizations from that work in different areas. So not necessarily in health, but they can work in also on in general social and economic rights. But the main focus in their work is to bring beneficiaries or citizens in the development of the activities and implementation of the activities. We can go next. Just brief, nothing.
Unë jam Rudina Basha, nga Mesia Vendore e Kujdesit Shëndetësor.
She works in a health unit. Rudina Basha. Basha.
Unë jam koordinatore.
She is a coordinator. She as maybe you recall when I had a presentation before in the session, that the health institutions are part of this, we call it ETANA. It's a multidisciplinary group. It's run by municipality, and health, according to legislation and sub-legal acts, they have a very special role in these mechanisms. In addition to provision of services, they are entitled also institutions of health to issue and to grant special medical reports. Ludina participates in this municipality of Tirana meetings, coordinated referral mechanisms, and for the issues, because there are, according to the different actors who are members of these mechanisms, and as institutions they provide services, dedicated services to victims of violence. In this case, they provide health services.
Just let me. For those who are online, because we don't have questions and comments, thank you very much for your participation. We don't want to keep you waiting. Thank you for your participation. We will continue with the conversation here. Feel free to go if you have any obligations or stay.
Well, I have another commitment in 10 minutes. I want to thank you all for your participation and also for support of listening to me. I hope I said some issues that are important for your development. COPASAH is focused on health, but we understand health not only as quality health services, but we consider health as the conditions of a healthy life, and that means environment, that means some social and economic stress we need to address for better understand the situation of our people. I think I finish with this, that COPASAH tries to highlight that are not seen by the usual analysis of health governments. The perspective and the of the people are important, and sometimes policies that well thought are unimplemented, and those running the state even don't get notice of how bad implemented they are. So we all have a role to fulfill, and I congratulate you for your responsibility and the efforts that you are making on behalf of the people. Thank you. Greetings from Peru, and hope this is not going to be the last moment that we meet.
Thank you, Ariel.
Bye bye. Thank you very much.
Okay, we can go with that.
I am Lilita Tzakun. I am a lawyer in the Human Rights and Democracy Center. Apevita first presented what our organization do in this field. I want to congratulate you for this session and also for all that you do in order to address this kind of issues.
Thank you.
I am Natasha Nikolari, and I come from the Albania, and it is an organization, local organization. We have been working in Albania since almost 60-70 years, but before 7 years we became independent. We have been cooperating with one big organization in Finland, which works for development community programs. One thing that I wanted to share is that I'm very happy that all of the presentations that were made, those who were online and us here present, is that all of us has the same scope of work. And for sure the human people are the focus. I am very happy today, this morning, when I was going for work, I thought to myself that I'm so happy that the NGOs exist in the world, because all of us do something for everyone. We can do everything everywhere, but I can do little, and all of us, we can do much together. So we work and we serve people. We see people as a human, and we don't help them only in one part. Someone worked in a health issue, someone else in the right, someone else somewhere else, but all of us, we also are a Christian organization, and we see people also from the spiritual side. And we help because the emotional problems are very high everywhere, especially those who are, but not only though, everywhere. So thank you very much for your invitation. We are very honored, and I appreciate very much everyone everywhere who works in a grassroots level or office, because office has lots of work, paperwork to do, but those who are in the field are not less than us who do that work. So in both areas, I'm very thankful, very honored. Kimetia Murati is my colleague. She does a very great job with the Roma community there where she works, and she helped me, and she's almost 20 years working with people, and she's a big mom. She's a big mama.
It's a pleasure.
Yes.
Hi, my name is Asia Duma. I'm the head of the psychologist sector in the hospital center Mother Teresa.
Thank you.
Thank you for sharing an interested and passionate field of community. Like we make this exchange and experience and lessons in the same time everywhere.
Thank you very much.
Thank you. Thank you for the invitation.
Thank you. We can go.
My name is Shifa. I'm leading in children organization. Bashkëpunojmë në Afganistanin, jemi organizatë që punojmë që nga vitin 1991.
We are active since 1991. As organizations, we cooperate together because our target is
Dhe si ndërtesa, dhe si apësi, po dhe si punë të përbashkëta, që kemi që punë të bashkëta.
we have as both organizations kind of the same focus.
Sepse gjithë logjika, gjithë këtyre viteve është që ne të punojmë në grupe. dhe sa më shumë organizata bashkëpunojnë në fokuset për COPASAH.
Experience in all these years that it's better when organizations themselves group and work together, and they start is greater than if organizations work alone.
Si eksperiencë e kaq viteve, kemi punuar shumë për të drejtat e grave.
We have worked a lot on women's rights.
Jemi dhe pjesë e ndërhyrjeve dhe legjislacion.
Part of interventions in legislation.
Që në ligjin e parë të bazës zinore,
At the first law on gender equality.
Dhe shumë dokumenta.
Many documents.
Sepse duke qenë një periudhë shumë e gjatë, detyrimisht që kemi dhe shumë aktivitete dhe shumë punë.
It's a long period, so we have carried out many activities and done much work.
Kemi punuar për të drejtat e fëmijëve dhe kryesisht me ato në aftësi kufizuar.
We have worked with children's rights as well and focused on disabled children.
Kemi ofruar shërbime sociale.
We have provided social services to them.
Për fëmijët, për gratë,
children, women,
pothuajse për gjithë dhe familjen,
and the whole community.
Për gjyshin dhe gjyshat të cilët ishin pjesë përfituese të shërbimeve që kemi ofruar në vite.
Elderly people as well, very included in the provisional services.
Dhe një pjesë kemi pas goxhat një grupim që kemi punuar si organizat për vëzhgimin e zgjedhjeve.
We have also been engaged in the monitoring of elections in Albania, like
Gjithmonë shoqëri civile.
Parliamentary
Pjesë e shoqërisë civile.
as part of civil society. And we have been grouped in coalitions.
Një grup prej 34 organizatësh.
This network of monitoring of election is comprised of 34 organizations.
Pra qëllimi kryesor ka qenë i grupimeve për punuar në grup organizatash.
The main purpose was to work as organizations and networks.
Duhet falenderojm Afërditën për këtë aktivitet sotshëm, i cili nuk është i pari, se ne kemi bashkëpunuar dhe do vazhdojmë bashkëpunojmë të tjera. Faleminderit Afërdita dhe gjithë grupit dhe stafit të sale që në. Dhe faleminderit edhe ju për
Thank you for participation. Okay, you can go.
My name is Anissa Shkoza and I'm from Nesmart Foundation, which is an Albanian contraceptive social marketing foundation. We try to do the direct distribution of contraceptives waste through the pharmacies with affordable prices, and also we try to inform such as target groups to develop the family planning and also to use the modern contraceptive ways.
Thank you. Thank you.
And Artiola is my colleague.
Would you like to introduce yourself, or we can go?
I think that I said everything.
Okay, we can.
Mimon Zadaka, coordinator of Channel
I'm the local coordinator of the HRDC. She's amongst the senior workers, and she does excellent work, especially in communities.
Thank you.
Unë quhem Valentina Larnica, jam financier, kam qenë drejtave të njeriut.
Finance officers to the HRDC. Valentina is engaged in financing matters in offices in Kropoyani.
Thank you.
My name is Irisona. I represent the Global Care Albania, the organization Global Care Albania. Our aim is to empower and support the young children with broader range activities. We also have a special kindergarten for children who has autism. Thank you for the invitation. It's my first time being in a
big group.
Yes.
Eleni Distorg, Drejtoria Rajonale e Shërbimit Social për Tiranën dhe njësosisht
She works in social services of Tirana.
Po, së Tiranës. Dhe njësosisht antare e të në, Sekretari Teknik dhe Sektorial pranë Bashkisë Tiranës.
She is also member of
Tirana Record United.
We call it EPNA, and our organization, as I told before, is member of these mechanisms, and we frequently participate in at least once a month the meetings that municipality of Tirana organizes in terms of provision of services for survivors of violence.
Thank you.
Next meeting is on Thursday. I just
Thank you all. I think that the group is wonderful. We have different kind of areas that we are covering, but we are, as you mentioned, we all work with the same aim and for the same benefits. So hope we can see each other again. Hope you will join us as a network and let us learn from your experience, and also let us share our experience with you. Visit our website if you have some questions or problems with the registration or submitting the interest that you would like to be part of the group. Contact with Afrodita. She will be the mediator among each other. But after that, we will be all in a group communication. Thank you very much. Thank you, Afrodita, for everything, and thank you for the speakers. We have